Hi, everyone. My name is Liz Lewis. I'm AVP Network Management at b.well Connected Health. And today we have a presentation with our partner, athenahealth, all about killing the clipboard. So as I mentioned, my name is Liz. I've been in the interop space for over 12 years, 13 years. I lost track at this point. And I'm joined by my colleague, Melissa, who I'll have to introduce herself.
Hi all, I'm Melissa Massardo. I am the Senior Manager Product Market Strategy at athenahealth. I've also been in the interop space for more than 10 years, so I'm excited to be here today and I'm excited to work with b.well.
So today we have a problem.
Liz, you have a large blended family. How old are your kids?
So I have 4 kids. I'd say 2 of them I made, 2 of them are my bonus kids, but they all live with me. So I have a 13-year-old, 2 10-year-olds, and a 7-year-old. What about you?
I also have a 7-year-old and a 10-year-old, and between them and me, we're in a doctor's office probably weekly.
All the time.
Yeah. I always take them, and every single time I fill out all of my forms on the portal electronically, and the doctors look at me crazy like I'm the only one that does that. And there's always a stack of clipboards at their office, and I just can't believe it. My kids don't do clipboards.
No. In fact, I'm not even really sure if they know what a clipboard is. Although they might think it's like something cool because they haven't really seen it.
Probably.
You know, like a box.
Yeah.
They hang out with. So what we're trying to do today is solve a problem that's been in existence for a long time, right? You go through the check-in process at your provider's office. You have to write down your medications. Luckily for me, I only have a couple of medications, but I can't spell them. And I don't know the doses. I don't memorize that stuff. All the procedures you had throughout your life, every single time you go, you're repeating that information over and over and over again. And I'm gonna be honest, I probably shouldn't admit this, but sometimes I just skip stuff because I don't want to write it down. Like I'm in a hurry. I'm ready to go, right? And so what we're working on today together is a process to seamlessly share that information with your provider at the point of care to alleviate these issues. Re-entering the data. Can you even read their handwriting? Are you sure you're getting that information correct? What about the semi-negligent patient like me who just omits information, right? It's challenging it, but there's a better way.
So the other problem we have is we're millennial moms.
Elder millennials.
Geriatric millennial moms. And we have a lot of apps. I have a lacrosse app. I have a hockey app. I have 2 different schools. I have 2 kids, 2 logins. My password manager has anxiety, so
Absolutely.
we can't. This is not sustainable. And if it's not an app, it's in a piece of paper crumpled in the bottom of the backpack. So that's not much better.
We probably won't see it.
No.
Yeah.
So next slide. Our kids aren't going to stand for this, right? They're not going to want to deal with mom 10 different apps. At school.
We don't really want to deal with it, but it's
we
going to
don't.
be unacceptable.
Their expectation when they are receiving their own care is going to be completely different. How do your kids log in?
It's all digital. I mean, our kids today are solely digital, right? Like they have a QR code, they log in, they get access to everything immediately through their Chromebooks. It's all interconnected and very simple for them to use. So that's going to be the expectation.
So at athenahealth, we've been working on digital patient experience for years. We have thousands of patients check in every single day using our app or a partner app. Almost all of our practices have not used paper in years. And so we're adding additional patient experience with every single release. And we're really excited to work with b.well to add another option for our patients to have that digital experience and share data with their provider in a way that makes sense for them in an app, a single app that they're really trusting in.
So let me tell you a little bit about what that means and what that looks like. So at b.well, we made a pledge as a part of the CMS health tech ecosystem over the summer. We pledged in a few different categories, but one of those was to kill the clipboard. And as the process of standing up a new ecosystem or framework has been taking root, we went ahead and did an early design in order to get this process started. So what that looks like is a patient logs into their application powered by b.well. they're able to connect their medical records from wherever they've been seen. So today we connect to patient access APIs, we connect to networks like Commonwealth, TEFCA, we connect to HIEs, we connect to labs. If there's a connection opportunity out there, like, we're going to chase it down. That includes these new CMS-aligned networks that are being stood up now. So the patient logs in, they go through identity verification, they query. They don't even query. They don't know that, right? They go to connect their records, and magically their data comes in. They can look at that information. They can mark medications as, past. I'm no longer taking this. I don't know how many times I've gone in and seen, like, you're still taking amoxicillin? No, that was 10 days. I'm not still taking it every day, right? They can mark that as past, change it. They can interact with their AI assistant to better understand in their own level, like, what's going on with their health? Why am I taking this medication? So all that's possible. But the next phase of this is, what can they do with that? So we created this, what we call Share My Record. The patient can go in and decide to share their medical record with their provider at the point of care. So they can go in, they're already identity verified, they can choose what data that they want to share. So maybe they're at a specialist appointment and only certain things are really relevant. It automatically selects everything, and then the patient can drill down from there, so they have control over their preferences of sharing. Then we create a digital insurance card, which is a part of the pledge, but also super cool because, I don't know, like, I went through multiple insurances in a short period of time, just due to, like, job changes. My husband changed his job. I changed, like, we were all over the place. And honestly, like, I didn't know if I even had my most current one on me.
I recently showed up with only my children's insurance card and not mine.
Whoopsies.
Yeah.
So digital insurance card. Why are we not already doing this? That's crazy. Why are you scanning that? Anyway, so digital insurance card, full health record. They slide to create the QR code. It pops up. And right there at the point of care, the provider can scan that QR code and get all of their clinical data through a smart health link. So this kind of walks you through that same flow, but what I wanted to highlight on this slide primarily is the integration after, which is when I'll hand it back to Melissa. So the data comes in to Athena1, and then in addition to that, immediately following the appointment, we are querying again and getting that post-visit summary back. So I just had my visit, I shared my data with my provider, then I had my encounter, something happened during that encounter, and now I can get that information back in real time, back into my application. Because I don't know about you, but I mean, especially even for my children, we go to the doctor, I'm gonna be honest, sometimes I'm on a work call while I'm in the doctor's office. I'm mostly listening to what's happening, but I need that refresher. I need that instant information back. And if you give it to me on a piece of paper, I mean, where does that end up? So
The floor of the car.
That's exactly right. The floor of the car, and then somebody steps on it, and then I throw it away. So closing that loop is really important.
All right, so this is what it ends up in Athena. So we've scanned the b.well clipboard. I'm going to plug the demo a little early, too. If you want to see the whole end-to-end actual demo, we're going to be immediately after this right over there in the b.well booth, okay? But so this is what it lands in Athena1. So Allison downloaded b.well. She had the QR code. The Athena provider scanned it, and it lives in Athena1. So these are all the data points that she has specifically chosen. So these are her allergies right here, medication. They can choose whatever they want their provider to see. And it lives along every other medical record. All the clinical documents live together in the Athena1 chart. If you go one more. So future state, this is the Athena's chart sync functionality. If it comes in via Fire, then we can fire some analytics on there, some clinical decision making, it can feed into our AI programs, but it really takes that burden off the provider. So the patient has shared the data in, it's auto-reconciled, it lives in that chart, it can flag medication interactions, allergies during medication prescriptions, but really the provider can use this data. They can assign a task to a medical assistant, et cetera, all based on the data that the patient brought in versus the provider just staring at a clipboard.
Yeah, I just want to double down on this because in the CMS health tech ecosystem, the early MVP, in order to get this thing off the ground, right? We got a directive and then we were like, okay, actually go do it now. The early stage MVP is bring in the PDF, right? It's all of these EHRs can bring in a PDF document, right? We know that. But Athena's really taking it a step further to get that discrete data. So the Smart Health link that I was mentioning that's behind the QR code, it will include a PDF through a document reference, but it'll also include a FHIR bundle. So that's what we're talking about here, is moving beyond just, here's a document that I can reference, no pun intended, the FHIR document reference, but here's the actual data that I can do something with, that we can take action on, right? That can become a part of the patient's chart. And I just wanted to highlight, like, that's part of the reason why this is so powerful. So what does this mean? The impact across the ecosystem, we think, this is just sort of like the tipping point in terms of killing the clipboard. There's a lot that can happen beyond this, right? This is our early days. But for the patient, they have control over their data, right? They have it centralized into one place. They get to make a decision that this is an application that I trust. As a part of the CMS health tech ecosystem, these applications have to go through the Karen Code of Conduct accreditation that's being managed by Direct Trust, or they have to go through DIME Society accreditation or certification. At b.well, we chose to do both, and we'll continue to support third-party accreditations because we expect the highest standard. But for the patient, they get to choose that, right? They say, this is the application that I want to use. This is where I want to get all of my data. For providers, faster check-in is fantastic, but reduced manual entry and really the removal of errors in the information. Maybe not entire removal, but we know what the data looks like. But at the same time, I mean, it's a big burden lift to have that data just automatically populated into the chart. That the patient says, here you go. Because we have national exchange. Like Melissa and I have been working on national exchange for a long time, right? Long time. And so this exchange is possible. And yet, when I go to the doctor, I still am being asked to fill out this information. You should already have this on me, right? So we're taking it one step further to say, yes, this exchange exists, provider to provider, treatment exchange works. But if you, for some reason, still need that at the point of care, here you go. It's all digital. And then for the industry, we really think that it's operationalizing a patient's right to access their own data. It also demonstrates real-world FHIR exchange. So we didn't really even touch on this, but we'll touch on it in the demo that we do live back in our booth. We have a direct FHIR connection to Athena, and that does not include a patient portal login. The patient goes through identity verification, like I said at the start, and then leverages that identity verification through an OIDC token to get access to their own data in FHIR, right? It's fantastic. And it moves from just being compliant to really taking this whole experience to the next level.
And just a quick touch on what's next. So obviously the goal, we've been marching towards this March 31st deadline to showcase what we're working on, but we need to roll this out more broadly across Athena to providers that are asking for this. We need to scale all of this nationwide, right? Like we're doing our single test patient, but we can make it work. Athena's single instance, we can deploy to any and all of our providers at the same time. And then again, this real world adoption, getting folks comfortable with the apps and the QR codes and really getting the providers really wanting that data inbound, things like that. So those are the things we're working on. I hear there might be more pledges in 2026, so keep them coming.
And the continuous refinement, right? Like this is our first step into giving the patient that ability to easily, seamlessly share their record. So we know that there's going to be an evolution to this over time. So we're really excited about that. And as we mentioned, we are going to do a live demo in our booth here shortly, but we're also open to any questions from you guys. Thank you.